Thank you. There we go. So once again, good evening to you all. I'm really excited to be here today and share my experience about SINA and how it has built me as a leader. So my name is Sylivia Kyomuhendo. I come from Namayingo district, that is Eastern Uganda. I'm a professional social worker, and by October, I'll be graduating as a public health specialist. And I'm the founder of Infant Cells Foundation. So as you know, just like any graduate in Uganda, I always knew that immediately after graduating, I was supposed to join the intense job market full of uncertainties to look for a job. So when I graduated in 2017, I was always anxious about what was going to happen to my life, because getting a job in Uganda is a real hassle. It needs who knows you to get a job. But I'm a girl from a poor background. I didn't know anyone. So I was anxious what was going to happen next. So as I was talking with a friend, he told me about SINA. He told me there is an organization that is empowering marginalized youth to be able to turn their challenges into opportunities and obviously become entrepreneurs. When I heard that, I got so excited and I was eager to join this community, but I didn't know how. He told me they were doing interviews, but it was already late because I hadn't applied. But he was like, this community is a good community. Let's go together. When they see you, they will allow you to take part in the interviews. So I followed him. As you know, it's a norm in Uganda. When you have interviews, you have to prepare, read about the organization we are going to do interviews. We all delved into that. Together with him, we made research about SINA, and we were well equipped to go and wow the judges. So when the due date reached, my friend put on a coat. I got my nice dress, expecting amplitudes or oral interviews. So when we reached SINA, the environment itself, it wowed me. I hadn't seen a place like SINA. When we waited for interviews, we saw the interviews were full of logical games and interactions. So when I saw how SINA did things differently, the way they interviewed us, I knew that this was the right place to be. And I really wanted not to go back. I wanted to secure for myself that scholarship. So I worked so hard throughout the activities they gave us to be able to be retained as a scholar. Lucky enough, on 1st February 2018, I was selected as a scholar. So while at SINA, it was really a home to stay. I found loving people, caring people, supportive people. They did not only provided me with the basic needs of life, which I couldn't provide for myself, but they also offered me the training and mentorship that has made me what I am today. So by listening to various mentors, my coaches, and the testimonies from the successful alumni of SINA, and going through different training sessions, I was able to build a team while at SINA. And we worked so hard and so smart to be able to also build a social enterprise that will be solving a problem that we have gone through, but as well as giving back or creating an impact in our community. So together with the guidance of my mentors and my coaches, I was able to start Infant Cells Foundation. And this was inspired by my personal story. Since at SINA, they train you to use your pain, the problem that you've gone through, to be able to create a solution, because you have passion to develop it even when you're passing through challenging times. So personally, I grew up in a remote community. Accessing a health facility was very difficult for us, my family and the community members, because first of all, the hospitals were at a very long distance. We had to walk 50 kilometers plus to access a nearby health facility. And since the health facilities were far, even the community members themselves were ignorant about the need to go to a health facility for health care. So we found ourselves relying on traditional healers, birth attendants, and herbalists. This was okay with us, not until one fateful day in 2007. My sister, Sarah, she was pregnant. She gave birth from home with the support of a traditional birth attendants, as they have always done it. But unfortunately, this time around, she wasn't lucky. She bled after birth and she eventually died because her birth was carried out by skilled personnel. So to make matters worse, the baby Malaika was born with spina bifida. This is the condition that comes about when a mother doesn't have enough folic acid while she's pregnant. So because of ignorance, my family and neighbors were like, this is witchcraft, this is witchcraft. We need to take this baby to be cleansed of the demons that were attacking her. So 2 weeks later, the baby also died. I felt so hurt losing loved ones, but at that moment, I didn't know what to do. I wished I could do anything to end the deaths that were happening in my community, but I didn't know how. Not until I joined the SINA. It opened my eyes and it taught me what to do. But you will learn that this wasn't only happening to my community alone, but the whole of Uganda, mostly in rural communities, they are suffering the same problems. Recently, the Ministry of Health reported that villages which are about 5 kilometers and above away from a nearby health facility, many women do not receive preconception care. When they get pregnant, they don't complete the recommended 8 antenatal visits. When it's time for giving birth, they give birth from home. After giving birth, they don't receive any preconceptional checkups. And this has led to needless deaths in the country. Because currently, on a daily basis, 10 women die due to childbirth complications. 71 babies are still born, and 61 newborns die, plus many unregistered deaths. As I have told you, marginalized mothers are giving birth from their homes. So there are many unregistered deaths that are going on that the government do not know. So that's why I'm so grateful to SINA. I'm indebted to SINA, because through SINA, I was able to turn my sad experience, my frustration of inaccessible health facilities into my passion and motivation to making sure that I bring essential healthcare services to mothers and their children where they are in remote communities. So that's how Infant Health Foundation was started. We started our operations in the middle of 2019. And our mission is to ensure that we improve access and utilization of the basic maternal, child and newborn health care services among rural low-income mothers and children under 5. So we do this by using motorcycle ambulances, and then we dispatch one-day comprehensive mobile outreach clinics that visit remote hardest to reach communities. We as well train health workers in patient-centered care model to ensure that they are able to give our beneficiaries the care they need with compassion, respect, and dignity. So how do we do this? We identify a rural community where you find that locals have to trek long distances at a greater cost to access a nearby health facility. So after identifying this place, we built partnerships and collaborations with the stakeholders, that is the district health department, the local leaders, the village health team members within that area. And after we have built this working relationship, together we mobilize for our beneficiaries that are women and children under 5. So they select a convenient place of meetup, which can be one of the beneficiaries' homes, can either be a church or a school where they feel comfortable. And now we establish our system of mobile outreaches. So on a monthly basis, 2 to 4 government health workers are transported with supplies to reach out to these communities and provide comprehensive maternal child health care services. For instance, antenatal care, child vaccinations, nutrition assessment, HIV testing and counseling, among other life-saving services. So at the end of the day, the health workers go back to their health posts and they will return to these villages on a scheduled date for continuity of care. So on the days when we are not operating the mobile clinics, our motorcycles now turn into a normal motorcycle business, and now it generates some revenue that supports us to sustain our activities. So to date, at Infant Cells Foundation, we have registered significant achievements. We are currently operating 25 mobile outreach clinics in the different villages, both on the mainland and on the island in Namaingo district, because Namaingo district is both a mainland and an island. So we have reached about 500 beneficiaries with our services. And through our work, we've been able to raise funding in form of grants from different sources. For instance, the PEPFAR grant, which is currently running. We have received funding from the Sun Family Support Grant, the Commonwealth Youth Awards Grant, the Pollination Grant, the Total Start Upper Grant, the Tony and Elumelo Foundation Grant, among other grants. We have also successfully built partnership with Vitamin Angels Alliance. It provides us with annual in-kind grants of multivitamins and albendazole on an annual basis that is worth $200 million, which we also supply to other health facilities that are not in our catchment area. And we have also joined different platforms that are helping us to grow and establish Infant Cells Foundation, like the One Young World, the Partnerships for Maternal and Newborn Child Health. We have also joined the Civicus Alliance. We have also joined the World Birth Defects Day Movement, among other forums. And me as a leader at Infant Cells Foundation, I've been able to present on different platforms to talk about our organization here in Uganda, in Rwanda, Sri Lanka, France, the UK, among other countries in Africa. And to tell you the truth, we are not stopping here. With the circle we have, with the support from SINA, because SINA doesn't stop supporting you. Even when you graduate and leave their premises, they are there to support. With their support and the support from the different forums, we believe we are going to expand and reach more other underserved communities in Uganda. We cannot stop. And together, when they bring us with people who are supportive, like people who are on this platform, I believe that together, we can achieve universal health coverage. We can address and eradicate inequities in healthcare access, and we can be able to build a world where no mother or child will have to die just because they are poor or they are living in a remote community and they don't have access to a health facility. So let's always work together. We shall be there. And as I conclude, I think I'll have to truthfully tell you that SINA, every marginalized youth in Uganda and Africa at large, I would wish that they get an opportunity to go through SINA. Because if we all can go through SINA, we can make Uganda a better place to be and the world at large. So for those who are supporting SINA, don't get tired, because your support is impacting a marginalized youth down there who had lost hope to make him a prominent leader in the world. Thank you.
Thank you so much, Sylvia. And I open it up for any questions, comments from anyone.
Sylvia, I'm so thrilled that you have such vision and such a sense of practical outreach, and just hearing all the names of the countries where you're making ties. You know, there are women all over the world who need, and children that need what you're doing in Uganda. I'm speechless. Thank you so much.
Speechless maybe captures
Hello,
the
sorry.
room.
I didn't get what she said.
She said she was speechless, and I think that captures the room at the moment. But
Yeah,
Carol, I
this
think, has a question or comment.
more of a comment. Yeah. You know, I just want to, I guess, reiterate that message of being speechless, but also I don't, there's a lady here who's very well known in the news world. Her name is Robin Roberts here in the US, and she always says, make your mess your message. And I think that's one of the things that you've really embraced here. And I just want to say I'm sorry for your loss and your losses. But thank you for taking that and making your mess your message and doing something about it. It's very inspiring.
So Sylvia, the work you're doing is very, very impressive. I'm wondering if you plan to expand kind of your outreach in the future, trying to grow the number of people that you're impacting. And if so, can you speak to that a little bit?
So we have plans to expand, but at the moment, where we are working currently, there are some of the issues that we have identified along the way that we need to address before we expand, because when you implement something, you learn something along the way. So as we're working, we realize that the women we are supporting, yes, we are giving them the necessary care, but when a child goes beyond 5 years, we have not helped this mother. So we are looking into expanding projects within Infant Cells Foundation that are empowering this mother to be able to afford the sophisticated care that we don't provide at Infant Cells Foundation. But when we achieve that, we are planning to go in other countries that are really suffering with the same problem. If we don't reach there ourselves, we plan to partner with different government, different NGOs that are in line with our work. Because even if we don't touch there with our hand, but we work in partnership with other organizations, we believe our impact will be felt. So at the moment, we just want to first help this mother to holistically be able to stand on our own before we expand to other communities.
Thank you.
Okay.